Patients often ask me whether a pacemaker can help treat their AF. And the answer to that is both yes and no. Pacemakers do one thing, and one thing only, but one thing exquisitely well, and that is they stop your heart going slowly. They don't directly do anything to get rid of or suppress AF. But I do implant pacemakers ultimately in quite a lot of patients with AF, and that's really for two reasons. The first reason applies to patients who have what we call paroxysmal AF, where AF comes and goes. Because we know that in this group, who are still spending time in normal sinus rhythm, their sinus rhythm, their normal rhythm can become very slow, to the point that they're feeling unwell, they're feeling fatigued, they're feeling breathless, sometimes they're feeling dizzy. And then we tend to make that worse by adding medications to suppress the AF, but which have a side effect of further slowing down the heart. So the answer in this group can sometimes be do an ablation to cure the AF, but an alternative, particularly perhaps in an older patient or a slightly frailer patient, can be to implant a pacemaker so that when they're in a normal rhythm, the pacemaker is boosting their heart rate and allows them to be on medications to effectively control the AF without suffering the side effects of the heart becoming slower. So this combination of a pacemaker and medications can be very effective to control AF and help a patient feel well. The second group of patients in whom I might implant a pacemaker are patients who have developed permanent AF. They're in AF all the time. We're not any longer seeking to get them back to a normal rhythm. We've accepted the presence of AF. And in this group, sometimes they also have what we call conduction system disease, so that the electrical connection from the top chamber to the bottom chamber is no longer effective, so their pulse is slow. Implanting a single lead pacemaker into this group simply to boost the ventricular rate, boost the pulse rate, is often all you need to do to make a patient feel much better. Contemporary pacemakers are very sophisticated devices. Fundamentally what they do is stop the heart from going slow. We program it with a baseline heart rate that will set the floor, the minimum heart rate that you might have overnight while you're asleep. However, contemporary pacemakers also know when you're active. They have something called an accelerometer, which physically detects movement, and some devices also have methods of detecting your breathing rate or the amount of air going in and out of your lungs. And a combination of those sensors allow a pacemaker to then pace you faster when it perceives that your physiologic demand is higher. So if you're exercising, if you're walking, the pacemaker will appropriately pace your heart faster to match your need, and that'll help keep you feel well.